big like this, all right, and I'm using my fingers. So this would be about
Come here.
about um, about 5 centimeters. And I know my fingers, but if you will look, my finger might be different from some big old doctor. All right, so I know that the tip of my finger is 1 centimeter. I also know from experience that that's about 5. Now, when she gets to be about 10, I won't be able to feel her cervix with either of my fingers. And that will mean that the baby is coming down, probably engaged, probably ready to really push and go for it. So we're going to, so at 4 centimeters, okay, or 5 centimeters, she's not ready to push. All right, so she's still descending. The baby is still descending. Okay, so I'm going to go in and check again. And all right, she's made some progress. I've got this now, so I'm saying probably more like 6 centimeters. All right, now all the while, what I'm doing is while this baby is descending, I am looking over at my fetal monitor. And here we can see that she's having some contractions. All right, the baby's heart rate is up here. Basically, the baby's heart rate is somewhat variable, and it's not reacting to any contractions, which may or may not be good. What you do want to see is some reaction, maybe a little acceleration in the heart rate. What you don't want to see is a deceleration after this contraction. So it's going to be kind of hard to show you with my fingers, but it'll come down like this and end up the deceleration will end up here or end here. So I will talk more about that in when I actually talk to you in the class. All right, let's go back over to mom here. Let's see how she's progressing. All right, she's still about the same. All right. Okay, so now what we're waiting for is the baby to descend, and as the baby begins to uh, come out, you're going to see a spot of the head, and she will be pushing, and that spot will get bigger. But after she's finished pushing, it'll get a little bit slower, and as she continues to push, that showing of the head, I'm not making any sense here, students, but that's okay, you get it. That little opening will get bigger and bigger and bigger until there it looks like the top of the head and a crown sitting on the top of the head, and that is actual crowning. And at that point, birth is imminent. Okay, so we're getting bigger, bigger, bigger. We're about like that. So I would say a good 7 centimeters. A good 7 centimeters. So we might can speed this whole labor up a little bit. At this point, she's in a lot of discomfort if she hasn't had an epidural. Now, most women these days get an epidural. Nothing wrong with that. I think the thing with an epidural is that it can cause a lowering of blood pressure. All right, and in that case, you will see the them giving a bolus of fluid to get her blood pressure to increase. So all of these things are going on. So the nurse in this case has to be aware of mom, has to be aware of the baby, has to be aware of this fetal monitor behind me, and a whole lot of things are happening at the same time. Once it is fully dilated, which it is, you can actually begin to feel the baby coming down. And if you'll notice right here, you can see the perineum bulging, and you can begin to see where that head is. Now, depending on which way the head is coming out, hopefully it's face down. That means that the smallest part of the head is entering, kind of making a wedge through the whole birth canal. And here you can see it's not quite crowned yet, but the baby's coming. We don't know whether it's a boy or a girl. As I said, Doc is usually there. However, nurses have delivered many a baby, and we don't get paid for it. The doctor still gets paid for it. Okay, baby's about crowning. Now what's going to happen right now is baby's head is going to come up. And the physician will often go in and check for the umbilical cord right now, because most often this can be just slipped right over the head. So, still coming, still coming, still coming. All right. And what's going to happen is the baby's head is going to lift up. And the cord was wrapped. Good job. All right. Now that the head is out, I'm going to pull down on the shoulders, the top shoulder, and then it stopped. Or is that as far as it goes? Okay. And then the upper shoulder. And this is no easy task. Keep in mind, I haven't delivered a whole lot of babies. And nurse is coming in to suction.
Suction the mouth first and then the nose. Because once you suction the nose, the baby is going to breathe. And you don't want them to take in any more amniotic fluid.
All right. Baby is born. More suctioning. All right. And now we want to get that baby right up on mom's abdomen. You cover the baby up. Dry the baby off. We're going to clamp the cord. And we'll clamp it in two places. The cut will be made in between. We aren't going to cut the cord. Just hug it.
The doctor is here.
Yes, Dr. Steven. And that, ladies and gentlemen, is pretty much the birth. We do have the placenta, which has been delivered. Guys, people say it really, really hurts a lot to deliver the placenta. Typically, it really doesn't. It might feel weird. It might feel a little uncomfortable. But the big thing with the placenta, this is the fetal side, and this is the maternal side. And on the maternal side, the physician is going to check to make sure that all of the pieces are there, because sometimes there's not, which means that a piece of this placenta can be retained in the uterus, which can ultimately cause bleeding and possibly even infection. So, with that said, do you want to take over with baby, or is this pretty much?
That's pretty much for me,
okay.
yeah.
All right. And that, my friends, is the end.